This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs.
Stan Morris reporting.
The Arkansas governor is speaking actually just a little bit ahead of schedule, and so we have rolled back the footage so that everybody joining us can see the press conference from the beginning, which we're going to join right now. The governor live from Little Rock talking about not just COVID-19, but the protests that have been going on. Let's listen in.
Thank you for joining me for a 1 o'clock news conference today. I wanted to be able to have a separate discussion on the events of last night, and I'm joined by Colonel Bill Bryant, the Director of the Arkansas State Police. And first, I wanted to emphasize that last night, as we've seen in previous nights, we had extraordinary peaceful protests by good citizens of Arkansas, and not just in Little Rock, but also in Fayetteville and other places across Arkansas. And also, as we have seen in other evenings, that as the night progressed, that there are certain elements that took their actions into their own hand and destroyed property and have in times committed acts of violence as well. As I indicated yesterday and on previous occasions, we will not tolerate the destruction of private property and the potential or the expression of violence. We want to make sure that we protect peaceful protest, but we also want to make sure that we have an environment that people are safe in their persons and in their property. And so yesterday, of course, as I have activated the National Guard so that they can support local law enforcement, I signed an executive order that is always done anytime you activate the National Guard, and it sets up a unified command structure. I want to emphasize that this unified command structure recognizes the individual agencies and their line of authority. And so the Sherwood Police Department participated in the unified command yesterday in our operations. And they, of course, report up to the Chief of Police here in Little Rock and North Little Rock. It reports up to the Chief of Police and to the Mayor. That line of authority continues. It is simply that we work together with a plan, and then the orders go out through those different agencies, and that respected chain of command that we respect with the city and with the municipal law enforcement agencies. All of this is the result of the tragic death of George Floyd. And as I've mentioned before, this is inexcusable. It cannot be tolerated. I am pleased that they have brought homicide charges. I expect more charges to be brought in that case, as they should be. And it causes everyone that loves law enforcement and appreciates what they do in public safety to look within ourselves and say, is there something we need to do better? Is there a dialogue that we need to have? Do we need to do more listening? And the answer is certainly we do. And I've started that conversation with members of the community, and I'll continue that conversation. And I want to hear about how we can do better, how we can make sure that we are providing equal justice and that we are not providing any discriminatory law enforcement actions. Last night, we had a combined force of 9 different federal, state, county, and municipal law enforcement agencies that participated in the protection of the protesters and making sure they can exercise their rights and at the same time protecting property. Their goal was to keep the peace, protect the free expression of protesters, and, as I said, to prevent violence. This is done through the unified command that respects the chain of command of each different municipality that participates, And I want to say thank you to the law enforcement agencies that did their job last night. They put themselves at risk. They act with restraint. And as you can see, last night the law enforcement agencies saw the peaceful protests at the Capitol. The curfew came at 8 p.m. And then after the curfew ended, the protesters continued. And they moved to the mansion where there were hundreds of protesters there. There was not any police action. It was respectful, even though it was in violation of the curfew. It was only when the certain elements went to destroy property that law enforcement moved in, as they have the responsibility to do. And I mentioned that they endanger themselves. This right here is a rock, but this is used as a weapon on Monday night against law enforcement, and I'm going to put it on the table, and I hope that each of you will take it. It's not the pebble that you throw into the creek and skip rocks with. This is a weapon, and I hope that you will take notice of that. That's just an example of what they have to exercise restraint through that kind of elements that challenge them. When I talked about the law enforcement agencies, it was the Arkansas State Police, the Little Rock Police Department, the North Little Rock Police Department, the Sherwood Police Department, the Pulaski County Sheriff's Department, the Arkansas Highway Police, Arkansas Game and Fish, FBI, and DEA coordinating together. And as they moved, as the protesters moved away from the mansion through Broadway, then it started to disintegrate into illegal behavior and destruction of property. If you'll put the first collage up here, this is the McDonald's on Broadway. I hope that you can see it, but you can see obviously, one, that there is a large stone that's taken away from here that presumably was thrown through the window and broke the glass of the McDonald's. There might be another picture of this, another picture of it with the stone laying down in the front. Whenever law enforcement sees this, that is their mission. Their mission is to stop this kind of destruction of property. And so that's when law enforcement started to respond, and they made 79 arrests last night. All of these were of Arkansas residents, I might add, but Colonel Bryant will have more to add to that. And so, again, I applaud the protesters and the way they behaved, but there is a certain element that once the nightfall hit, they were looking for an excuse both to destroy property but also confront the police. In fact, that became their design, is to confront police. And that's whenever, with that destruction of property, the police moved in. I think they did their job last night. I look forward to a continued conversation. I also want to assure everyone that if they decide to continue the protest, then law enforcement will be there to protect them, to make sure that they have access to exercise their rights, which is so important in our society, and is an important time to listen and to be able to express the frustration and anger and distrust that is in so many's heart. And so that we respect, and we'll protect them, but we also will protect the property to make sure that doesn't happen again. And as you can see last night on Capitol Avenue, that was almost a large amount of property damage was done the night before. That was not happening last night, and I thought it was a successful operation. Colonel Bryant, I applaud you and your team on that. I invite you to come and make your comments.
Thank you, Governor. Before we get started, I'd like to take this opportunity. Just last time I was up here, I didn't get a chance to talk. I was mostly answering questions, but this is my 44th year in law enforcement, and I really believe law enforcement is a calling. And I too applaud Governor Hutchinson as well as every professional law enforcement officer in the state of Arkansas that the treatment of Mr. Floyd and his death is just totally unacceptable. It's detestable. Any law enforcement officer who is a professional will tell you that. Our job is to protect and serve the citizens of Arkansas. The core values of the Arkansas State Police is integrity and character. And what served me well is when I talk to other law enforcement agencies or teach classes, you treat everybody with dignity and respect. It doesn't matter if you're white, black, young, or old. I still say yes or no, sir, to young adults. That's the way I was raised. But what served me well over 44 years, you treat them with dignity and respect, and then you usually get dignity and respect back. But again, as far as last night, the peaceful protesters, as long as it remained peaceful, we were there to protect them. Even after the curfew, they went over to the governor's mansion, and I was advised, some of my troopers, they were advised, hey, that you were in violation. We took no enforcement action. They left the area. The triggering event is when they threw the large stone through the McDonald's. After that, we were able to, means like Facebook Live, but they were chatting. It's time, for the confrontation with the police. They proceeded down Broadway to the area of the Pulaski County Courthouse, and that time the decision was made to go ahead and move law enforcement elements in. And as you can imagine, it was a kind of a chaotic scene because the protesters attempted to flee. And so it was pretty chaotic, knowing what we already knew that they've done, have broken the windows and threatened that it's time for confrontational with the police. But we tried to do the best we can. We detained those people for officer safety until we could get the scene back to a calm manner. As a result of taking the subjects into custody last night, we seized 2 Glock 9mm. The protesters were armed, and they were booked with obstructing governmental operations. But what I want to do the other day, y'all asked us questions about the media and about the steps and what we've taken. But just to give you a general idea, for like the Saturday night protest, before we reached the Capitol or we were approaching the Capitol, they were firing weapons in the air. Here are the 4 cartridges, and I'll be glad to put that on the table and let y'all look at that. The first measure was they blocked the interstate. We were able to move them with voluntary compliance, and that was great. They went back to the Capitol. That's when they started destroying the Capitol. We had vehicles doing donuts in the Capitol grass. The Capitol Police got bottles thrown at them and rocks as they tried to move their vehicles. So at that point, a decision was made to go ahead and we were going to disperse the crowd. While we were en route to the crowd, they got back on the interstate. Again, we approached them and sought voluntary compliance. They were immediately shelled with rocks. At that time, we deployed crowd control measures. They went back up to the Capitol, and as we continued to try to do that, I think these cartridges where somebody's in a vehicle got a 9mm and was shooting in the air. So we were meeting violence. We were met with violence. We'd rather have voluntary compliance, believe me. I've been around 44 years. Crowd control used to be the old saying, you had bats and hats. That was the only devices law enforcement had to use. Now we use other measures. Sunday, the same thing is where they began pouring accelerants on the ground and lighting that on fire, and then they started burglarizing and vandalizing the 501 building. That was the triggering event. As long as they're peaceful, we're there to protect them. But we have to address the crime by the rule of law. We have to have the rule of law. And then Monday, what we really saw was more aggression from the protesters. They became more confrontational. They had measures to defeat if they did have to apply any kind of chemical agent. The main thing that we saw was, they just really aggressively came to us. We didn't approach, we always give them plenty of time to disperse. We give them 5 to 8 warnings over a period of 5 to 8 minutes and try to get their compliance. But when they started charging law enforcement and started assaulting us with rocks or pouring beer on our officers and doing different things, we have to take the appropriate action. We're not going to use excessive force. We're committed to that because of character and integrity. We're going to do the right thing. And then Tuesday night, where they went away from the Capitol and started breaking windows and things like that, we were able to, if I could, the next slide, if we could hit. What we're finding from Tuesday night, and then we found some yesterday, or Monday night, excuse me, these, where they busted the windows, these are incinerated devices. It's a water bottle filled with pure alcohol, and it's like a M80 firecracker. It's basically a Molotov cocktail. They tried to set buildings on fire. We recovered, go ahead and back up one, please. We recovered another one yesterday. During Monday nights, they actually set buildings on fire. The state police responded with fire extinguishers so the fire department could get there. But, once we dispersed that crowd Monday night, they broke off into splinter groups and began violent acts all over the city. Go ahead and go to the next one. Last night, we recovered things before the protest started last night. That's a sprayer full of gasoline to use to start fires. What was very important last night, and it really helped, I believe, we saw vehicles where they're actually hiding bricks in the grass and the shrubs around the Capitol. They were pre-staging devices to cause destruction. So these are some of the obstacles that the law enforcement is facing. Our job is to enforce the rule of law. We're sworn to, if we see a criminal law violation like that, we want to take action, appropriate action. Last night, there were no crowd control devices used, anything. It was just they were taken into custody. They were at the mansion, reminded of the curfew. They chose not to do it, but we took no enforcement action. They were peaceful. We were trying to work with them and get that accomplished. I believe that's the last of the slides, but what we're going to do is, it was a great team effort last night. I want to applaud the officers. They show great restraint. We want them to be able to exercise their First Amendment rights as long as it's peaceful. And we will protect them while they're doing that. I think I've proved that here as 5.5 years as the director of state police, as many protests that we've had here at the Capitol. So we're going to continue to protect those protesters. But again, for those who agitate, a lot of the people last night, what we saw were from the local area. We did some, I don't want to get in much detail, we did serve some vehicles from out-of-state tags that were inciting them. A lot of these people you'll see, I think in the press release come out later, they're young adults. Could be influenced easily, but they're very organized. They do counter surveillance on law enforcement, determine where we're set up, do different things. But without getting too much detail, I just want to assure the citizens of Arkansas, we're going to protect you for your First Amendment rights, but we're also going to protect our other citizens from crime, violence, or vandalism. Thank you, Governor.
And we have a limited amount of time, but we'll take a few questions.
When the executive order was signed, and then was there any delay between when it was signed and when it was publicly announced?
No, it was, first of all, it's a fairly, we activate the Guard, we sign the executive order. It's very similar to what we've done in previous circumstances, and that was signed yesterday afternoon, and it was put up on the website. Yes?
We know at least 3 journalists were part of that group that was detained last night, so can you just tell us what your response is to that, and is there any kind of directive for law enforcement to follow when it comes to protecting journalists when they're out on the job?
Well, they need to be protected. I think we all know of one journalist who was harmed very severely the other night and went to the hospital. And so journalists is part of the responsibility of law enforcement to protect in these kind of circumstances. And we recognize that journalists have a job to do, and though they're out there reporting, and it's very important. So I applaud the journalists for that. And they should not be arrested, but they have to be identified, and when they're identified as a journalist, obviously they should go about their business. Yes?
How do you know those objects are from protesters? Is that just speculation?
Bill?
The rocks, one of my troopers was hit in the head with this and picked it up there at the Capitol on Monday night. These were in the same area where the vehicle was observed, where the person pulled the gun out and fired the 4 rounds. We have some great peaceful protesters. We do, and we respect that right. But I'm telling you, it has escalated. When you start staging bricks and you have incendiary devices trying to set buildings on fire, that's not peaceful.
Next question. Yes.
Can you go a little bit more into detail about the motivation of putting the state in a state of emergency? Is that going to be a continuing concern?
Well, I'll certainly lift that as soon as we're satisfied that there's not any risk to property or to people. And anytime you're having congregations of hundreds and thousands sometimes of protesters, you're going to have elements that come in. And so during that time, and it's been demonstrated, there needs to be a great law enforcement response and capability. And you saw the difference between Monday night and Tuesday night. Monday night, the elements that were violent did their damage, and I said that's not going to happen again. And so that's the reason that we brought in more, put in the unified command structure. We brought in more law enforcement support, assistance of the National Guard to make sure that we had the resources to protect people and property. Yes.
Have we seen any credible threats of any outside organization, Antifa, anybody else like that? And then also, too, have there been any out-of-state arrests made?
There has not been any out-of-state arrests made last night or in the previous night that I'm aware of, at least in central Arkansas. And the intelligence is that the out-of-state influencers are here, that they are helping to coordinate, and they're helping to motivate the violent elements. And so, whenever you're from out of state, somehow they have a means of getting other people arrested and not themselves. So they were certainly part of the element that encouraged the strife and the destructive behavior.
You said that there was a notable difference between Monday night and last night. Do you attribute that just to ramping up the numbers of law enforcement out there, or were they doing different tactics that you then saw protesters respond less?
Well, that's a very good question. And I mean, first of all, you did have an earlier curfew the second night, and then it's a combination of the curfew plus the law enforcement presence that was visible, and so the violent element knew that they're going to have a difficult time with that law enforcement presence, and it happened later, and we responded very quickly in contrast to previous occasions. But the other part of your point is they adjust their tactics as well. And so there's a lot of potential targets out there, and we have intelligence information as to whether it's a Target store or whether it is a mall that could be the target of looting or this violent element. And so we have to be prepared to deploy law enforcement very quickly, or to pre-position them based upon the information that we might have. But they adjust their tactics as well. One final question. Yes?
Can we get a remote question?
Does it concern you that they're openly carrying a weapon in front of City Hall right now? Because I've got video of it, some of the protesters. City police went and talked to him because it is legal, he's legal, but he's walking around with it draped, hanging off of his shoulder.
Well, it's a concern, even though it is a right and they're doing it legally. It is still something that could provoke a response that we have to worry about, or it could be misused. So certainly I have that concern. One question remotely.
Hi, Governor, this is Maureen Glissick with KTV. I wanted to ask you about just the jurisdiction under the state police and state of emergency. It was reported to us last night that a worker from Arkansas Children's Hospital was driving home and was pulled over by a state police trooper, and it was for violating curfew. It was around 10:05 p.m. She showed her hospital credentials, and it took a security guard from Children's to meet her at the site to prove that the credentials weren't fake. So what are people's rights at this point, especially with the curfew in the city of Little Rock, and what are people supposed to do? Can they get pulled over just for violating curfew?
Colonel?
Maureen, this is Bill Bryant with the State Police. I've just made aware of the incident a while ago. We'll fully investigate it, but the Arkansas State Police has jurisdiction statewide. We have, in all 75 counties, we have the law enforcement authority. I'm afraid to comment or guess, speculate, but what we'll do is we'll get our public information officer after this to get with you, and we'll research the matter and be glad to get back to you.
All right, thank you. We have...
Okay, but can you tell me, are we going to get pulled over for violating curfew? That's what I'd like to know. I think people need to know that.
No, ma'am, that's not going to be our standard practice. Just like last night, we could have stopped everybody in the city of Little Rock. We didn't. I don't know the circumstances, what caused that, But I think we've been very generous, and the governor and I share the same philosophy. If you're peaceful and doing it, you're not going to attract the attention of law enforcement.
Thank you all very much. We'll reconvene shortly for the COVID report.
So stick with us here, because what we're going to do, we actually had that on a bit of a delay. And while we have that delay going, it's going to allow us to jump ahead to see if there's the report that's available just yet, which it should be. So the governor, of course, was addressing the protest across the state of Arkansas, and specifically more so in Little Rock. We heard about that. We also heard from Arkansas State Police Colonel Bill Bryant, and we've heard a lot of folks in chat too. I mean, this is one of those situations. We get it. There's a lot of tensions, and there's a lot of emotions surrounding this. The protests have now gone on for a pretty significant period of time, most of the last week, I guess. And so stand by, because we should have this feed ready to go here.
I didn't realize how well we were doing. And so I was very pleased
go back
with
to the governor.
some
if
of
you
those
give me just a second, I want to
that,
make sure I start this at the right point.
I think we've had, so we care for 2,000 staff in Arkansas that are totally free of COVID.
All right. So stand by, everybody, just for a second, and we'll have the governor back up with you live.
Yesterday we had 7,818 cases. We have an additional 249
1,208 are active.
So there appears to be an audio issue. That's what was taking me a moment at the beginning of this, but we're going to take it from the beginning, and we will listen in as soon as the audio picks up from the governor. This is the state's feed, by the way, so the issue would be on their end and not ours.
Which brings us to 8,067 cases in Arkansas, which is, of course, not active cases, but the cumulative total of cases. In terms of hospitalizations, we have 132 yesterday hospitalizations, and we add 6 to it, so we are now at 138. In terms of Arkansans who have died because of COVID-19, yesterday we were 136, and very sadly we have an additional 6 that brings the total to 142. And so you can see that this is not as high as yesterday, but it's still a high number of cases. And let's go ahead and look at the charts here, if you will. The number of cases in Arkansas, which you can see yesterday was a real about 370. That's down to 249, I believe it is. And so you can see that is really actually sort of the new level that we have with our increased level of testing. Go to the next one, you'll see the 7-day rolling average, which still puts us on that trend line up. We hope that that's going to flatten out at some point. And then the next slide on the hospitalizations, that you see that we're actually at the highest number of hospitalizations at 140. And then we have the number of active cases. We wanted to focus a little bit on nursing homes today, and so this one is a new one, and this is the number of active cases, not cumulative cases, but active cases in nursing homes. And you can see that we got to our peak of over 120 active cases in nursing homes in Arkansas. And then we've been on a decline since then, which is really good news. Now, of course, you can see that it's still back up to 101, but that's down from where we were at our height, so that is moving in the right direction. And then the next chart we'll have is going back to our testing here in the state. And you can see our positivity rate still is right at 5%, a little bit under 5%. And so we're remaining steady on that statistic, which I'm pleased with. And I think that's, let's see what we have next. And this is on the nursing home. If you look at the red dots, those are positive patients or staff in nursing homes around Arkansas. And what I want you to see are the green dots. And the green are ones that are COVID-free. And so it puts it a little bit more in perspective that we have a lot of nursing homes in Arkansas that are totally free of COVID, both staff and residents. We want to see all of those move to a green status. And then the next one, we'll talk about our long-term and congregate care testing plan. And let me just reiterate that our goal in June is to test Okay, I think they fixed it. I thought it was a reporter at first, and then I recognized it was me. That's even more problematic. But we set as a goal to test every resident in a nursing home in Arkansas in June along with the staff. And this tells us how we're going to get there by June 30th or the first week in July. And that is the key partnership with LabCorp, which we have an agreement with, a commercial testing site, to return the test very quickly. And we're talking about 16,000 to 18,000 nursing home residents with 20 to 22,000 staff. You have the DHS facilities, 5,000 residents and staff. Alternate to living facilities, 6,000 residents and 5,000 staff. And that's one of the reasons that we have Secretary Gillespie here, is because they have to be engaged in this partnership for the testing, both from youth services to our community centers that have the disabilities that are located in those facilities that we want testing. The reason all of this is important is that these represent the most vulnerable citizens of Arkansas, and they're also our family members. And so we care for them, we love them, we want them to have a safe environment, and I applaud the Healthcare Association, Rachel Bunch, for really making sure and working hard that we minimize and try to reduce COVID-19 in the nursing homes, and I think we've had some success as a result of that. Yesterday I testified before a congressional hearing, and part of it was our testing, part of it was nursing homes, and I was with two other governors from other states, and one of the questions read the statistics of Arkansas and COVID-19 positive cases in our nursing homes versus other states, and I didn't realize how well we were doing. And so I was very pleased with some of those statistics that compare us, that we have really been able to manage our way through this to protect as many patients as we can. With that, Dr. Smith.
Thank you, Governor. I'll give a few more details on the numbers and maybe a little bit more focus on the nursing homes as well. The Governor mentioned that we've had 249 new cases. 4 of them have been in correctional facilities, so 245 in the community. So our total 8,067 total cases. Of those, 2,208 are active cases. 102 of those are in nursing homes. So nursing home cases represent 5.2% of all of our cases, but only 4.6% of our active cases. 55 of our active cases are in correctional facilities, and so 2,051 are active cases in the community. The little uptick on the active cases in nursing homes that you saw in the graph that the Governor showed just a little bit ago were the 19 from the nursing home in Jacksonville that I mentioned yesterday. So that brings our total nursing home residents that have tested positive for COVID-19 to 423, which I mentioned is 5.2% of our total cases. We also have had 28 staff, nursing home staff test positive. That brings our total for nursing home staff to 289, and that is 3.6% of our total cases. The governor mentioned the net increase of 6 in our hospitalized to bring us to 138 hospitalized patients. We currently have 30 on a ventilator. That's a decrease of 1, and we've had 6 new deaths, so 142. Although we are doing very well compared to other states in terms of our nursing home deaths per 1,000 nursing home residents, and I believe Rachel will probably talk about that in just a little bit, still the 55 nursing home resident deaths we've had make up 39% of our total deaths. So this is our nursing home residents are very vulnerable, and that's why we spent so much time focusing on them, trying to protect them. And again, even though they're only about 5% of our total cases, they are a very high percentage, 39% of our total deaths. We have had 5,717 have recovered. That's an increase of 150 from yesterday. In terms of the 249 new cases, where they're coming from is similar to what we've seen in the previous few days. We had 28 from Washington County, 20 from Benton County, 23 from Sevier County. Now, something that's new is we had 33 from Pulaski County, and these were not associated with the nursing home. So we're going to have to watch our numbers here in Pulaski County and be very careful not to let down on those practices of physical distancing, wearing masks, etc. Crittenden County also had 18 cases. In terms of testing, we're also doing well there. We had 3,872 reports from yesterday with a 4.8% positivity. So our total for the month of June so far is 7,717. With that, I'm going to go ahead and turn it over to the governor, and I believe Rachel will also be talking about some of our numbers from nursing homes compared with other states.
As Rachel comes up, I just wanted to say one of the goals of increased testing in our nursing homes is to have a plan so that down the road we can be successful in allowing family visits to nursing home residents. We want to have healthy facilities. We want to have the right protocols in place. We want to be able to have family visitation. We're not there yet, but that's one of the stepping stones, is to do this testing so we can get there. And Rachel's been a very big proponent of that. But thank you for your partnership.
Thank you. Thank you all for the opportunity to provide another update on long-term care in Arkansas. I wanted to speak today about 2 items: the statewide testing initiative and reopening of facilities. As you all know, this virus has disproportionately affected our elderly population, and we definitely appreciate the resources and continued acknowledgement from our governor on behalf of these frail Arkansans. There's no question that our population is the highest risk for the challenges presented by COVID-19, and long-term care centers are dealing with unprecedented challenges that are faced nowhere else. It remains true, though, that the extraordinary people that care for these vulnerable residents are doing heroic work to keep them as safe and well as possible during this time. Dr. Smith mentioned the report that came out this week. There's a new reporting system with the CDC for nursing home data related to COVID-19. And according to this data, how Arkansas ranks in comparison to other states in our nation, they set it up based on number of affected patients and staff members out of every 1,000 residents. So Arkansas has an average of 23.6 cases per 1,000 patients, where the national average is 62 patients. So we're much lower there. Arkansas has had an average of 6 resident deaths out of every 1,000 versus the national average of 27.5. Arkansas was 41st, in a good way, in total nursing home staff cases per 1,000 in every nursing home. The average for Arkansas is 13.9, and the national average is 39.5. And to date, I'm so very thankful that Arkansas has had 0 long-term care staff member deaths. To talk about testing for a minute, throughout the month of June, we'll be taking part in a statewide COVID-19 testing initiative for long-term care. This will allow us to establish a baseline of both patients and staff. We have worked with the health department on a schedule and are coordinating with facilities. The logistics of this process are massive, and we've never done anything quite like this before, but I have great confidence in both my members and our partners that are working with this, and I know that we will meet the governor's expectations. Having this information about where positive cases are will help us make decisions and implications for the future. While facilities continue to screen every day and visitation restrictions are still in place for now, we fully expect that through this initiative, we will identify additional positive patients and staff, and it will cause our numbers to rise. Just like out in the community, a large number of positive cases in long-term care have been asymptomatic. While an increase in these numbers may be startling, and that's what we expect, it will improve our ability to confront the threat of the virus and further protect our patients. I'd like to thank our partners in this initiative to listening to our requests for a less invasive option for this testing and helping us to make that happen. We are now able to offer the least invasive type of nasal swab for our patients and staff. They'll be much easier than the standard COVID-19 test, and that was a question that I got from many staff members and family members that have reached out to us. Next, on reopening. The Healthcare Association continues to work with leadership at the health department on guidelines for reopening. We appreciate their direction and their clinical expertise on these guidelines and protocols. While we aren't finished with this yet, it's in the works, and I think we're close to a plan on reopening, and that will be tied to the testing initiative. These guidelines and protocols include those on communal dining, activities, and most importantly, family visitation. Throughout this process, end-of-life visitation has always been allowed, and that will continue through the coming months. We don't expect that to change. Facilities have provided PPE and worked with family members to wear at the time and work to allow those visits at end-of-life situation. If you have a loved one that's at end-of-life, the facility and medical director will continue to work with those families and allow visitation during this time. For the majority of our residents, though, and the rest of our communities, husbands, wives, sons, daughters, grandchildren, neighbors, and friends have been so patiently waiting to visit their loved ones in facilities. And your loved ones are waiting even more to see you. We appreciate the patience that we've seen throughout this process. It's been so difficult, and the reopening, just like everything else, will take time, and I'm sure that we'll see constant adjustments as we go through the process. Our staff members have worked so hard to facilitate FaceTime visits, window visits, and others at a distance during this time. While this is better than nothing during a time of crisis, we know that these residents and family members really want to see their loved ones. Our elders look so forward to visits with these people, and I don't have to tell you that those visits really matter. I know from my own experience, my grandmother looks forward to visiting with me at least as much as I look forward to visiting with her, if not more. She's 92 and watching now. Throughout my own life, I've had many memorable, serious conversations with her, but just as much, we enjoy catching up on politics, the weather, what we're having for dinner, and telling funny stories. We understand the need to balance resident protections in our facilities with the benefits of visitation. This has been such a difficult time for our residents. The mental health of our patients has a real and lasting effect. Until we can get to some sense of normalcy through reopening and being able to see them again, that effect remains. Their day-to-day lives have changed since this began, and those visitor restrictions went into place in March. We would ask for your continued patience during this time. Similar to other businesses in the state, visitation in nursing homes will not look the same as it did before the virus, and we may have to make changes going forward. We have proposed an individual facility approach for reopening. As the governor stated, some facilities have been affected by the virus, but many, I would say most, have not been. This would allow for facilities who complete their statewide baseline testing to start this reopening process with limitations in place as outlined by the health department. Some facilities may open before others, and testing with negative results will have to happen before reopening occurs. There's a lot of work left to be done here, but we remain dedicated and look forward to completing our statewide testing and carefully opening our doors to see our families and friends. Thank you.
Thank you, and we'll open it up for questions, and if there's some questions about some of our DHS facilities that will be tested, we'll certainly call up Secretary Gillespie or Kisa. Any questions?
I guess I'm wondering, even though they're still working on the guidelines, how would you allow people to safely visit nursing homes?
Let me bring Dr. Smith back up for that.
Good question. We're going to be very careful because these are very vulnerable patients, and we will be looking. There's a number of criteria that have been set out by CMS, and we're using those in addition to what we've learned about COVID-19 here. But some of the requirements will be that visitors will have to be screened. They'll have to wear a mask at all times when they're in a facility. They'll be visiting with the patients for the most part in a designated area rather than going back into the rooms, et cetera. So these are some things that we can do to make that as safe as possible, limiting the number of visitors, screening out those who might have higher risk of COVID-19. There are ways that we can do this to not make it zero risk, but to minimize that risk. And again, this is something that that we're going to do very carefully and cautiously, but I think there's ways that we can do this to make that happen.
Next question, Jay.
I guess, Dr. Smith, do we know how many of some of the recent cases have been connected to, like restaurants, barbershops, et cetera, et cetera?
We are tabulating that twice a week, and the most recent one, it's been less than 1%. I'll be looking at that again on Friday.
So where are we seeing a lot of this community spread, or how are we seeing it?
Well, in terms of where, the geographic areas, the two areas are really the sort of northwest corner, the Washington County, Benton County, Sevier County as well. With DeQueen, we're seeing the most growth in the Latino community, and we're seeing younger people. We're seeing the fastest growth in number of cases in those basically in the 25 and under age group. So we are seeing both community spread, and then we're seeing involvement in some of the poultry-related industries as well. So we're attacking this, both in terms of working with those workplaces to make them as safe as possible, but also doing those contact tracing in the community.
Are we seeing like more of a how? I mean, if very few of these are connected to loosened restrictions, and obviously some of the poultry industry is accounted for, right? Over 200 for the past about week now. I mean, have we been able to explain where people are coming into contact?
Well, we know that there's a couple answers to that. The highest risk setting, of course, is in a household. And if one member of the household is infected, it's very difficult to keep the other members of the household, especially if they've not been tested. You don't know who's infected, who's not. The second is community events. People get together in a community. I'm not picking out birthday parties, but things of that sort. In some cases, we know that church services have been associated with those groups. And then, of course, we do have work sites. The work site probably is the area that is easiest to institute strict controls. It's a lot harder to do that in the community. And we are communal people, and it's really difficult for us to remember the physical distancing, the masks, and the other things, especially when we're around people that we know really well. We're thinking in our mind, there's no way this person could have COVID-19, but anyone could have COVID-19.
All All right, we're going to see if we can get some questions in, so we're going to do quick questions and quick answers. Next question.
Of the 4 new prison cases, can you say where those are? And then of the prisoners who are being considered recovered, how is that determination being made? Are they being retested, or is it just a matter of time passing?
I don't have information on these specific. We still did have some cases coming in from various units. We don't have any active large outbreaks going on. And in terms of recovering, when they've completed 14 days, we consider them recovered, unless they're hospitalized or in some other special situation.
Do you know the racial demographics of the active cases?
Yes, that's a report that we do twice a week as well, and so I'll be looking at that again on Friday.
Is there a question remotely? Anybody at the table?
On the nursing home testing, is that going to be the nursing homes themselves that administer the test, and who's going to pay for the test?
The test will be administered in the nursing home. The staff will be able to take the swab and send it to the lab and get it delivered back, and coordinating that with the Department of Health. In terms of paying for it, they've worked out where they will be able to bill insurance or Medicaid provider if that's covered. And of course, if there's not that coverage, then they will be able to have the test free, and that expense is covered under the CARES Act funding. Let me invite, in conclusion, Cindy, why don't you come and just tell how this impacts some of your facilities, and we'll wrap it up.
Thank you, Governor. As the Governor mentioned, the Human Development Centers and the Arkansas Health Center are also part of this first round of testing that's being done. So we are notifying today all the parents and guardians. They're going to be receiving a letter letting them know that we are going to be conducting this testing. As Rachel mentioned, this is quite a logistical exercise to go through, because we have about 800 total tests that we'll be doing at the Arkansas Health Center. But when you look across the Human Development Centers, it gets to be closer to 3,000 tests between the residents and the employees that are at those centers. They'll conduct them in those, we'll do the nursing home June 9th through the 11th. So in 3 days, they will conduct all of this, and the health department will return our results. And we will do the Human Development Centers the following week, the 15th through the 17th. Again, as he said, a large logistical exercise to do this. These facilities have all been shut down to visitors since the start of this public health emergency. So as Rachel said, while we are preparing in case there are positives, we're also obviously going to be hopeful that having been shut down as long as we have for visitors, it will be minimal. But we are making preparations to ensure that should it turn out a number of the employees or any of the employees do test positive but have been asymptomatic, that we will have plans in place to ensure that we're able to meet ratios and have adequate care there. So there'll be a lot of contact over the next few days and the next 2 weeks with the parents and guardians. And our emphasis, of course, will remain keeping our residents safe. That will be our primary focus over the next month as we go through this.
Thank you, Cindy. And with that, we will conclude it, and you all have a great day. Thank you.